بالانجليزي. طيب ماشي.
بسم الله الرحمن الرحيم. هنتكلم النهارده على الفينس ثرومبوامبوليزم ذا سايلنت كيلر. الحقيقه الفينس ثرومبوامبوليزم is a major disease. لو فكرنا انه في الصوت كده مسموع؟
لا قرب شويه.
طيب كده كويس. 10 million cases every year worldwide of DVT. منهم 3 million deaths per year. 20% of patients with active cancer يجيلهم DVT. And 60% of all cases of DVT is after hospitalization. This is the big numbers of patients with DVT. Of course, all of us know the famous Virchow's triad, which is hypercoagulability, maybe due to major surgery, trauma, malignancy, etc., vascular endothelial damage, thrombophlebitis, atherosclerosis, or circulatory stasis. ودي أكتر حاجة طبعا مشهورة فيها الإموبيليتي أو الفينس obstruction. The risk factors of DVT are usually divided into transient during operation or after operation, or persistent because the patient has a disease that's lasting with him and he is in need of prevention of DVT all the time. And major versus minor risk factors. These distinctions are very useful to determine the risk of VTE. So, the optimal duration of anticoagulant prophylaxis or treatment that should be used. يبقى لازم أعرف أنا عندي major ولا minor risk، أعرف عندي transient or persistent cause عشان أعرف حد الانتيكواجولانت ده لقد إيه. طيب what are the risk factors? The most common risk factors and well known. Number one, positive family history. And number two is obesity, old age, bedridden more than 5 days, estrogen therapy, fractures hip and knee, varicose veins, pregnancy, congestive heart failure, and surgery. And the most important is the patients with cancer. During treatment, surgery, and in the post-operative period with chemotherapy, they are more prone to get DVT. And usually this occurs when the patient goes home and he stopped the anticoagulant he is receiving. The VTE risk scores for different patient profiles. عندنا كذا نوع من السكورز. أول نوع في السيرجري أو في الميديكال إل Caprini score, which is a very famous. Ambulatory cancer patients is the Corona score, and in pregnancy the RCOG score اللي هو Royal College of Obstetrics and Gynecology score. Now we are going to discuss some points of general surgery. DVT is common in patients with general surgery, and the incidence reach up to 38%. From 16% up to 38% among general surgery patients, and maybe as high as 60% for patients with orthopedics. ده يورينا حجم المشكلة. 40% ده أكتر، يعني قرب على نص العيانين. طيب during the acute phase of DVT 10 to 40% of patients may develop pulmonary embolism, and this will have a mortality up to 20%. يعني في الأكيوت phase up to 40% patients يجي لهم pulmonary embolism, and 10 to 20% of these may die. إذا المورتاليتي of pulmonary embolism تصل إلى 20%, and it may reach 30% if we include the autopsy patients. So the cost burden of this disease is quite high. Patients will need prolonged hospitalization, and patients will need multiple investigations, وكل دي حاجات مكلفة. This is the famous Caprini score. أنا بس هوجه النظر في الكابريني سكور على most frequent missed risk factors. أول حاجة نبص الage. 1 point لو العيان سنه above 40، ودي ما أعتقدش إنه في حد بيفكر فيها. If he is more than 40, he is a 1 point risk. Pregnancy أو postpartum within 1 month مهمة جدا. حاجة بقى مهمة جدا للجراحين وهي history of inflammatory bowel disease. And this inflammatory bowel disease increases the incidence of DVT. Why? Number one, because it is a pelvic operation and you are manipulating وتحط retractors على the veins of the pelvis. ثانيا, because of it is an autoimmune condition. And with autoimmune conditions, the DVT is much more common. في 2 points مهم جدا: the presence of malignancy, present or previous, the presence of plaster cast within 1 month. This will give the patient 2 points. And treatment with hormones. All these are risk factors for patients with cancer. The patients with chemotherapy usually have an incidence of DVT, and once they go home, they stop this anticoagulant and may develop pulmonary embolism. So we have different risk assessment models based on every patient profile. So we have Caprini score for cancer patient and surgery, cancer patient in the ICU, and we have Corona score for ambulatory cancer patients. And this Corona score is a very famous, and thromboembolism reaches up to 12.9%. About 13% of patients with 3 or higher Corona score will get DVT. What about thrombosis in pregnant females? Venous thromboembolism complicates up to 2 per 1,000 pregnancies and contributes to 9.2% of pregnancy-related deaths in USA. 20 to 50% of women who develop venous thromboembolism during pregnancy have an underlying inherited thrombophilia. And the risk of VTE is greatest 1 to 2 weeks post-mortem, post-delivery, postpartum. And women with previous DVT have an increased risk of recurrence in pregnancy and postpartum, with reported incidence of up to 11%. So there is a problem with pregnancy. There is a problem after pregnancy. That's why they have their special protocol. The VTA risk assessment model is the RCOG, Royal College of Obstetrics and Gynecology. There is high risk and immediate or intermediate risk and low risk. In summary, this is the last slide. What we'd like to do in this project, we have to say that we have to make the young generations, the doctors, the physicians, know that VTA is a preventable complication that possesses a risk of morbidity and mortality. And the question is, do these patients need prophylaxis? So what type of prophylaxis should be used? When you have to give anticoagulants? And for how long this anticoagulant should be used? Thank you very much.